Garlic is one of the most well-known foods in the world. It has been used in cooking, folk medicine, and even in various wellness practices for thousands of years. Some consider garlic a true natural remedy, capable of cleansing blood vessels and lowering blood pressure. Others believe its beneficial properties are greatly exaggerated. So where is the truth? What actually happens in the body after we eat a clove of garlic? To understand, we need to start with the main substance that gives garlic its reputation. When you cut or crush a clove of garlic, a compound called allicin is formed. This compound is responsible for its characteristic smell and many biological effects. Interestingly, a whole clove contains almost no allicin. It appears only after damage to the garlic cells. After eating garlic, its active substances begin to be absorbed in the digestive tract and enter the bloodstream. Research shows that some garlic compounds can affect the health of the vascular wall. In particular, they can promote increased production of nitric oxide, a substance that helps blood vessels relax and dilate. When blood vessels become more relaxed, blood flows through them more easily. This can lead to a moderate decrease in blood pressure. However, it's important to understand one caveat. Garlic doesn't act as an emergency medicine. If your blood pressure is high right now, eating a clove of garlic won't produce an immediate result. Numerous studies show that regular garlic consumption can indeed have a mild blood pressure lowering effect. In some cases, the blood pressure reduction is comparable to the effect of mild non-drug lifestyle modifications. However, the effect usually develops gradually, over weeks or months. There's a popular myth that garlic supposedly cleanses blood vessels of cholesterol, like a pipe cleaner. In reality, blood vessels work quite differently. Cholesterol plaques don't fall off or dissolve instantly after eating certain foods. However, garlic can indeed have a certain effect on lipid profiles. Some studies show a slight reduction in total cholesterol and low-density lipoprotein levels with regular consumption of garlic supplements. However, this effect is usually moderate and does not replace medically prescribed treatment. Another interesting mechanism involves antioxidant activity. Garlic's active compounds can reduce oxidative stress. Oxidative stress is considered a factor in vascular wall damage and the development of cardiovascular disease. When free radicals damage vascular cells, inflammatory processes are triggered. Over time, this can contribute to the development of atherosclerosis. Antioxidants help partially counteract these processes and cause unpleasant side effects. The most common of these are related to the gastrointestinal tract. These include heartburn, abdominal pain, bloating, nausea, and irritation of the stomach lining. These symptoms are especially common in people with gastritis, high acidity, or sensitive digestion. Some people experience a significant drop in blood pressure. Although rare, combining garlic with antihypertensive medications can enhance the effect. Interestingly, garlic's odor isn't limited to the mouth. After digestion, volatile sulfur-containing compounds are formed, which are excreted through the lungs and skin. This is why the odor can linger for many hours after eating. Another common question concerns raw versus cooked garlic. Heat treatment does reduce the amount of some active ingredients. However, the beneficial properties are not completely eliminated. The effects may simply differ. Raw garlic typically contains more compounds associated with the formation of allicin. Cooked garlic may be gentler on the stomach and easier for many people to tolerate. Aged garlic extracts are also available. Some studies suggest that they may offer beneficial properties with less irritating effects on the digestive tract. It's important to remember that vascular health depends on more than just one food. Even if garlic has beneficial properties, it can't compensate for smoking, chronic sleep deprivation, physical inactivity, and in excess of ultra-processed foods. Think of your blood vessels as the complex transportation system of a large city. If roads have been damaged, polluted, and overloaded for years, one healthy food won't instantly restore the entire infrastructure. Real results are achieved only through a combination of factors. Regular physical activity improves the function of the vascular endothelium. Weight control reduces the burden on the cardiovascular system. Quitting smoking significantly reduces the risk of vascular damage. A diet with sufficient vegetables, fruits, and fiber helps maintain normal cholesterol levels. Amid such a lifestyle, garlic can be a beneficial nutrient, but don't consider it a miracle cure. People with stomach conditions deserve special mention. For them, raw garlic can sometimes cause significant discomfort. In such cases, the benefits may outweigh the potential harm. Pregnant women, those post-surgery, and those taking blood-thinning medications should also exercise caution with Concentrated garlic supplements. Sometimes online, you can find promises that garlic will completely cleanse blood vessels in a week, dissolve plaque, and eliminate hypertension permanently. Such claims are not supported by modern medicine. The reality is less sensational, but more convincing. Garlic does contain biologically active substances. It can moderately support cardiovascular health. It may slightly lower blood pressure and improve some blood parameters. However, its effect is limited and is not a substitute for medical treatment. In summary, consuming garlic does not magically cleanse blood vessels. Instead, the active compounds can help blood vessels relax, maintain normal endothelial function, reduce oxidative stress, and slightly influence cholesterol levels and blood pressure. This is why garlic has earned its reputation as a healthy food. But its main power lies not in miracles, but in its small, gradual effects on the body when consumed regularly as part of a healthy lifestyle. So the next time you see a headline claiming that garlic completely cleanses blood vessels in just a few days, take such promises with a grain of salt. Science tells a different story. Garlic can be a useful aid for heart and vascular health, but it's not a magic pill for all problems. Therefore, the best approach is to use it as part of a balanced diet and remember that vascular health depends on many daily habits. Description: what happens to blood vessels and blood pressure after eating garlic? Can garlic cleanse blood vessels, lower cholesterol, and treat hypertension? In this video, we explore in detail the scientific data on the benefits and harms of garlic, the effects of allicin on the body, its effect on the cardiovascular system, possible side effects, and common myths.